you everyone for being here today. We'll go ahead and get started on the presentation, and we'll be saving questions for the end. So please make sure to get those in using that format, and we'll try to answer as many possible at the end. Today, we are hoping, to explain more on prerequisite skills to evaluating readiness for toileting, educating on different implementation strategies, and then going over evidence-based practices with toilet training research.
Before we get started too far, we want to talk a little bit about the context of toileting. People get really whipped up about toileting. It's a big deal for parents, mostly because it's a big sign of independence. Parents get really nervous about if their child has attained toilet training because they worry that if it's not mastered, then, oh, can my kid go to school or not? Sometimes they get pressure from well-meaning relatives, but it's important to note that, this is a skill that happens at different times for different individuals, and that even if your child is not ready for toileting, when they're ready for school, the school needs to be ready for that child. So if your child's ready for preschool and meets the criteria for preschool, the school needs to be ready for your child and can make accommodations for that. With certain diagnoses, the pediatrician can prescribe diapers for your child. So this is also important for parents to know. So a lot of things can help kind of take some of that pressure off. There's also a lot of cultural differences when it comes to toileting. So, for example, individuals who live closer to the equator are just a whole lot quicker to potty train their children. There's a lot of reasons for that, as far as, how they go about their day-to-day practices and what they might be wearing or how they might be going about their day. And just in general, we tend to be getting delayed further and further in the US in toilet training. Those diapers are very absorbent, and it makes it harder for kids to realize that, oh, I'm wet now. So some of the advances in what we use has really kind of elongated the time that kids are in diapers. And even within the US, culturally, there's some differences about when toilet training should begin. So, there's just some differences between white and non-white parents.
So a common question received is when to start, and that's a pretty complicated question, but we like to and we'll go over a checklist in a little bit, but these are just some potential indicators. If a child does not meet some of these readiness kind of milestones, it does not mean they aren't ready. These are just some cues that might help us think, okay, maybe this is a good time to start. So, so some developmental readiness might be the ability to walk and sit on the toilet, staying dry for up to 2 hours. Some of those motor readiness, like pulling pants up and down, communication, both receptive communication about ability to follow an instruction, and having a plan or to be able to help the child communicate and initiate that they need to go to the bathroom. We also look at physical readiness, so evaluating voluntary control, and it typically appears by 18 months in neurotypical children. Ability to recognize that there's a physical urge to urinate or have a bowel movement, is also a point of physical readiness.
There are also some points of behavioral readiness to help the process run smoothly. Most kids need to be able to imitate different behaviors, such as sitting on the toilet, understanding what happens when you sit on the toilet, having a cognitive awareness of what happens when things go in the toilet will help them kind of understand that process more too. You also want your child to have some understanding that they're separate from you. So their ability to say no helps show us that they're understanding that they're independent and need to be able to kind of figure out those urges and feelings themselves, like what Sam was talking about. You also want it to be as a cooperative experience for both you and your child. So your child's ability to follow your directions, have less power struggles, their interest in toileting will be really great indicators that they're ready to start working on that process too. And just in general, their own interest of toileting and wanting to stay dry are also really key indicators that it might be time to start. Also, a really big thing that we need to keep in consideration is your readiness as parents, understanding that toileting might take a long time, and also understanding that there might be ebbs and flows in the process and being okay with that. In general, it's best to make sure that your child's motivation and readiness is driving your plan for toileting rather than your interest in having them being toilet trained. It's also important to know that it doesn't have any impact on your child's intelligence or their stubbornness if toileting takes a little bit longer than you think it might. There's quite a lot of skills that go into toileting that we'll talk about later in this presentation that we have to make sure that kids have the ability to do. Also knowing that accidents are going to happen and that's okay, and having a plan in place for when that happens. Punishment has been shown through research and evidence to not be a good support when working on toileting. Any sort of punishment or things that kind of make the child feel bad about toileting not going well delays the process more. So you want to make sure it's as supportive as it can be, and that it might take a long time. It might take a couple months, it might take a couple weeks. So just knowing that you have a plan to dedicate the time to do this for a long-term part of your life. Like I said earlier, there are quite a few skills that kids need to have in their repertoire for toileting to go smoothly. Those include motor coordination skills, different sensory processing abilities, interoception, and reflexes. So we'll go into a little bit more of what all that means. So when we talk about motor coordination, I'm referring to kind of fine motor coordination and motor planning that are skills that are needed for kids to do things like manage fasteners, get up onto a toilet, understanding how to wash their hands afterwards. So there's lots of factors that can kind of go into their motor planning and their ability to be more independent with these activities. It's important to also know that when we're starting to work on toileting, it's going to take a longer amount of time, especially if what parts of toileting you're really wanting the child to work on. So maybe for a couple of days, you're working on them just managing their own fasteners, pulling their pants up and down, making sure that you're giving them that time to work on that skill, and then also helping them with maybe skills that they need a little bit more support with. It is going to be easier to work on some of these skills earlier if you're giving them a little bit more support with like managing fasteners, having clothes that are easy to take on and off. Because I'm sure, as you all know, sometimes it can be a quick turnaround when they're needing to go to the bathroom. So Suzanne likes to give the example, this is not a good time to be putting your kids in overalls because that's going to take a little bit of time to get them out of those. So motor coordination skills are things that you can look out for and help them work on those skills if they need a little bit of a boost. A huge role in toileting is sensory processing. So sensory integration involves our ability to perceive sensory input in our environment, modulate it so we don't get overwhelmed, organize that, and then interpret what we need to do with that information. So if kids are needing more support in different areas with sensory processing, it might take a little bit longer for them to work on some adaptive strategies to make toileting go a little bit easier. So we'll kind of go through all of the senses and how they impact toileting as well. So a lot of kids, like I said, if they have differences with their sensory processing abilities, that might impact what toileting looks like for them and how they become independent. Some really good ideas of just things to keep in mind are, as much as we can modify the environment to be supportive to promote independence, are really good first steps to do. And then there are so many adaptive seating options, adaptive clothing options out there right now that that's also a really good place to start too. So first couple senses that we'll talk about are touch and hearing. So when we think about sitting on a toilet seat, it can be cold, it can be an abrupt change in temperature. Some kids don't like the feeling of toilet paper. There's just a lot of tactile information that they're processing with toileting too. So some good strategies to kind of help decrease that amount of input are to have any like padding on the seat, so it's not, you know, the porcelain that's touching their bottom. Different toilet papers are softer or don't fall apart as easily. So those would be some good things to try. And also just thinking about, you know, like what the kid's wearing, time of year. If you're working on toileting during the winter months and they're having to take off jeans or sweatpants, that's going to be kind of a drastic temperature for their skin too. There are lots of unexpected sounds when we think about toileting. If you're in a public restroom, there's other people using the restroom. There's automatic flushers, automatic hand dryers. Sometimes not being able to see someone turn the sink on and off can be challenging for kids. So it's really good to kind of think about toileting in those environments kind of as separate. So you're working on toileting at home and then knowing that working on toileting in public places might take a couple other supports. A lot of kids have good luck with bringing headphones into public toilets. So they know I put my headphones on, I can go in here, I'm not startled by any of the unexpected noises. You can also, a lot of families maybe bring in like stickers or something to cover over that automatic flusher. So the kid is in control of when the toilet flushes. And then a lot of times in your own home, making sure that your child is in charge of starting those sounds. So they're in charge of flushing, they're in charge of turning on the water and off the water. So it's just a little less abrupt for them and they're able to kind of process that information that's going to come into their environment too. And as they continue to practice, it will take less and less, modifications for them to be able to tolerate some unexpected noises, because we all know that those do happen. The sight and smell of restrooms can be overwhelming to everyone, including kids when they're working on toileting. Public restrooms can often be messy. They can often have a lot of smells that kids are not used to smelling. All bathrooms are set up differently, so it might be different from a kid working on toileting at grandparents' house or at their school or at their daycare. So just knowing that kids might need some more help in different environments, knowing where everything is and knowing where to organize, how things are organized too. A good strategy to kind of help with smell is any sort of spray, or there's poopery that you can use, helps just decrease the smell that kids experience when they're going to the bathroom. Cleaning the bathroom more regularly might help as well. Other times, sometimes kids will maybe have a good smelling soap that they use to wash their hands afterwards, or a good smelling lotion to help with that too. Two senses that are a little less common that you hear about when you're talking about just your senses in your environment are proprioception and interoception. So proprioception is our body's ability to know where we are in space and what's around us and how far those things are from us. So we're not running into things, we're not falling down. So strong proprioceptive skills are skills that I know exactly where my body is in space at all times. No matter where I move, I'm able to kind of adjust. Interoception is our body's internal receptors knowing things like I'm hungry, I need to go to the bathroom, I'm tired. And so kids and young adults, if they need some more supports with either of these senses, might have some difficulties with toileting. And that's kind of when different OT things might help them build those skills too. So interoception would be, those kids or young adults where then all of a sudden, like, I need to go to the bathroom right now. They might not have those internal receptors aren't clicking earlier enough in their setting up for them to go to the bathroom. So it's like a very urgent need. So there's some different sensory strategies that kids can work on to help them build those skills. Proprioception would be those kids that might be nervous to sit on the toilet, or having their feet off the ground makes them feel very anxious. So sitting on a toilet where my feet are off the ground and I feel like my bottom's going to fall through might make toileting a more scary experience for them than it needs to be. So different things like adaptive seating to give them more support, stools for their feet to stay on when they're using the toilet. For younger kids, they make, smaller toilets that they can work on at first when they're practicing going to the bathroom. So just different ways that you can help support their sensory system to make sure they feel safe when they're working on toileting are good strategies to work on when you're building up your proprioceptive system. So we'll talk a little bit more about interoception because it plays a really big role in toileting and a really big role in a kid's ability to be successful with toileting in multiple environments. So like I said before, interoception is the feeling and understanding of internal signs within our bodies that it's time to go to the bathroom, it's time to eat, it's time to go to bed, kind of those internal things that our body just has a clock for. Building interoception skills will help with toileting because it will help take out that urge where it has to happen right now. So it's going to give the kids and it's going to give the families more time to work on that skill in real time too. Like I said, occupational therapy can help with building those skills if some just strategies aren't working. Some strategies that you could try are, and Sam will go more into it, are practicing going to the bathroom at a timed routine during your day, things like that. We also want to make sure that kids have like a strong understanding of what signals mean in their body. So they know, like, when I feel this way, that means I need to go to the bathroom. When I feel this way, it means that I need to go ask for a snack. So just building their interoception skills will help with toileting as well. And modifying environments for toileting, I think, is a really big thing that sometimes gets forgotten about and can help really kids be successful a little bit more quickly because they feel more supported in the bathroom. Safety helps promote independence. So things that you could add to your bathroom might be grab bars, bidets to help with wiping thoroughness, squatty potties to have something for their feet to sit on, and insert so they're not feeling like they're falling through the seat, are all different ways that you can just make sure that they feel comfortable when sitting on the toilet. And it might just be practicing sitting on the toilet for a couple of days and then helping them feel supported with those extra supports. There's a lot of things on Amazon, a lot of things out there that you can make sure that it will fit and work in your home too. Another big thing to think about is clothing management. When you're thinking about toileting, there are a lot of adaptive clothing options out there for individuals so they can be more independent with toileting as a whole, whatever age they are. The adaptive clothing can also help from a sensory perspective as well as a motor perspective. So there's seamless clothing, there's clothing with magnetic fasteners. There's new styles of adaptive clothing that look a little bit dressier. So it's not always sweatpants or leggings. You can find some different bottoms that might fit, their style preferences, but also be easy to manage too. The last kind of readiness thing that we'll talk about is reflex integration. So we are all born with primitive reflexes to help us survive. And our body works on integrating those reflexes so then they don't become a barrier for us as we grow older. Sometimes when primitive reflexes are retained and they're not integrated, they can play a role with different developmental delays, including toileting. It's one of those things where you might have retained reflexes and never know it, and you function fine. You might have integrated reflexes, but they still don't work for you. So it could be something that an occupational therapist can dig into a little bit more, especially if you've tried, everything and it's still not working. Sometimes looking at reflexes is the next kind of thing to look at as well. So when you're thinking about reflex integration, it's really important to know that it's going to take a long time to work on your body to rewire all those neuro connections. So occupational therapy can help with identifying what reflexes are still present, are they having an impact on function, and then how to help integrate those reflexes. And we really find the best outcomes when parents are involved and help do the home programming, because it is rewiring your brain to integrate those reflexes so they aren't a barrier to your independence with things like toileting, clothing management, vision, all those things. For older children who might still have accidents at nighttime, there might be some specific reflexes that we can look at as well that might be playing a role on why daytime dryness is happening, but they're still having accidents in the evening when they're asleep.
So Maggie discussed a lot of the kind of readiness perspective. So this is a checklist that includes some of the things Maggie mentioned, but also some just other areas. So when we start to consider, again, the readiness for toileting, I think the largest part is, from my perspective, is usually about getting ready. So all those adaptive things Maggie was talking about or other areas. Some examples of a checklist that you could use to kind of evaluate a child's readiness is the communication. Are they able to communicate when they're wet or soiled? Do you see or notice any discomfort or indication that they may want a diaper changed or they may be a little bit uncomfortable? Has the child ever eliminated in the toilet? Are they do they ever ask to sit on the toilet? Might indicate some interest. Are they comfortable? Do they feel safe? And are they tolerating sitting on the toilet for at least 2 minutes? That one has a little star by it, because usually we can't start toilet training until we have a child feeling comfortable. And again, that toilet is safe. And they're okay and they feel okay with sitting on the toilet for 2 minutes. If we have an instance where, okay, maybe that one is not yet there, then we know, perfect, that's a good starting point. We're just going to have planned practice opportunities, maybe make that toilet, consider the adaptive options. And how do we start slow? Maybe we start with just 1 second with their clothes on, that they're sitting on the toilet, and we work toward 2 minutes. And just kind of starting where that child is and considering any adaptations that may help along the way. Another piece is, are they experiencing bowel movements that are regular and predictable? Ability to pull pants up and down, showing any interest in underwear. Underwear, again, it's new. It's a different sensory feeling. Clothes fit different. It feels different. So another question that we often ask is like a definitely one to consider before starting is the child able to tolerate wearing underwear for 30 minutes? And if not, again, we just start where that child is. Maybe at first we just need to touch the underwear. Maybe at first we need to put the underwear over the diaper, and then just work our way toward feeling comfortable with wearing the underwear. And then the other component would be from a parent or caregiver readiness, usually with a more intensive toilet training approach. We would recommend that once we kind of move away from the diaper, we don't go back. So we ask families, like, is this a good time to completely stop wearing pull-ups and really just move toward wearing the underwear? Does the child wake up dry? And then another key area we look at is there any medical conditions that could impact toileting? A big one we see is constipation, and just making sure that we have considered it. Do we have a plan? Is there anything that we could proactively help do to support those medical complexities that impact toileting? And then specifically for a more intensive toileting approach, we ask for a dedicated time, approximately 2 to 5 days, to really focus in on toilet training. And that will really help kind of for children who need a more intensive approach, teach it across those days, but throughout the whole day. And then the last piece is to track how often a child eliminates is really good information to help us know where to start. So this is just a kind of a easy from creating a word, not easy to do every day, I will say. Tracking this can be hard. 30 minutes goes very quickly when all of a sudden you need to check again. But ideally, if there is a day or a time period you have where you can check, is my child wet or dry, every 30 minutes, it really does help there be an understanding of bladder control and how often the child is eliminating. So if we were to approach toileting with more of a more intensive approach across 2 to 5 days or 2 to 7 days, again, we're first going to evaluate those key toilet readiness skills. If those are not yet there, we would just first focus on those as skill areas and then come back to intensive toilet training. And that's just because we don't want to be working on 2 really complicated, hard skills at the same time. We don't want to be focused on, maybe a child that doesn't love to wear underwear, but now also has to go to the bathroom and eliminate on the toilet. So we just like to try to think, how can this be as easy as possible for everyone? And then from there, after that, that 30-minute data is done, we look at that and determine, okay, how often should this child sit on the toilet to try to catch the child eliminating in the toilet, and then become on a same plan and communicate expectations that we will have accidents, and it will take a lot of time over these next 2 to 7 days. And then before we begin, we always like to identify a communication system for the child. Every child has a different way and a different preferred way of communicating. So we try to think about the preferred way that feels easiest for that child. So for example, if a child is able to say vocally, I need to go to the bathroom, but a visual support really helps them communicate, we would want to make sure all of those that is accessible for the child as well, and we are including that as part of the protocol. And then within it, we want to create motivation and fun. So this is about being silly, having some fun in the bathroom, identifying any game or activities the child may enjoy, and make it as exciting as possible to go to the bathroom. We're asking a lot of the child, and we're asking a lot of the family to really dedicate the time to do this. So we've really tried to think about how can this be as enjoyable as possible, that the child really does, is contributing to how do we teach this. And then again, the visual support. So maybe helping increase our visual supports during this time. There might be like a first then that might help a child understand expectations or kind of what's coming next. We talked about, silly things like putting Cheerios in the toilet to aim at, also understanding that things go in the toilet. And also video models can be helpful as well to help the child kind of visually process the toileting experience. So if we were, again, moving forward with a more intensive protocol across a few days, might be one example. So the time, the first column is the schedule. So we call it a sit schedule and time off schedule. The goal of this schedule is really to catch the child with success. So we really want that first, if possible, few times the child eliminates to be in the toilet so that they can start seeing that connection. When I sit and I go, that is that success happened on the toilet instead of being an accident. Certainly doesn't always, it honestly rarely always happens like that at first, but the goal is that we can try to increase as much success as possible that first day. So for example, the time on the toilet might be 10 minutes and then time off 10 minutes. So every 10 minutes we are trying to sit on the toilet. And then the second column, it just talks about motivation and reinforcement. So many kids that I support through toileting, at first, praise is okay, but it's not going to make or break that understanding of like this, I just swim in the toilet and now something amazing is happening, just to try to pair that connection really, really strong in the beginning. So for example, our reinforcer for this particular child, on the toilet, we were singing songs, doing all sorts of fun things, but as soon as they started eliminating or immediately after, they had access to a favorite iPad game. And that was just to make sure that we were pretty distinct with that the eliminating and making it having that body awareness. I just eliminated, I get this fun iPad game. Then the last column is the mastery and move schedule. So what that just means is as soon as a child has 2 successes on the toilet, or 0 accidents for an hour, we would then move the child from that 10 minutes on, off, and then move them up to 5 minutes on the toilet, 20 minutes off. And that just helps kind of have a goal in mind for that initial phase. So as you can kind of see in this example, the child's moving from 10 on, 10 off, to 5 minutes on the toilet, to 20 minutes off, and then to 3 minutes on the toilet, and then an hour off. And then after that point, we would want to start waiting for that child to initiate that they need to go to the bathroom, so that and then we would still deliver the iPad, and then eventually we just fade that iPad out, and maybe now it's just part of the routine, and we're just praising and with excitement after they go. So another pieces of the protocol is just that accidents will happen, and that is just okay. We just try to redirect to toilet, like, oh, time, let's go to the bathroom. Like pee in the toilet. It is never a again, kind of what Maggie was referring to, a negative or something to feel bad about. It's just part of expected. So we just remind, like, hey, let's go to the bathroom and sit back down. Dry pants check is also helpful for kids that can process that dry or wet, and so they're kind of increasingly aware of their own underwear and it being dry or wet. During intensive toileting, we also increase liquids because we want more opportunities for success. So if the child loves a certain juice or chocolate milk, and within reason, of course, we would want them to be drinking as much as possible to get as many opportunities as possible. And then we're going to fade that schedule that was on the previous page and really consider reinforcement for that child. One of the trickiest pieces when we do kind of talk with families about reinforcement is it needs to be immediate after they go to the bathroom and kind of distinct so that it is it's noticeable that it's here. And then the last one is contingent. So that just is saying that we would wait for that child to go to the bathroom and the toilet before they have access to this item or this thing. And that's important because we wouldn't want to choose something that the child is expecting to have on a daily basis or is part of like a really critical routine or anything like that. We would want to choose something that would feel easily or manageable for that family and for the child to wait until they go to the bathroom to have access to.
There may be some other reasons why kids are unsuccessful or incompletely successful in eliminating on the toilet. Beyond resistance, sometimes children will have accidents long after they've been toilet trained. It's always important to rule out those medical concerns, like Sam said. We need to make sure that constipation has been addressed. Sometimes constipation is misunderstood, and it's important to note that usually constipation also comes with diarrhea. It's not just constipation. You get both. It's the double gift. You get constipation with diarrhea most often. And then when you have a child who really hates their constipation, then they will try to not go because it's painful. So you get extra constipation. But that can also cause some problems with urination, sometimes with kids. But you also want to rule out some other sorts of problems that could be related to some medical concerns. Those are listed there for you. Kids who have UTIs or even juvenile diabetes. Some kids just don't completely eliminate their bladder. Either they are rushed, or maybe they have a medical issue that's just preventing them from completely eliminating. A lot of kids go through a check with urology to make sure that that's not an issue, and get cleared without any problems. But it's good to check through that. Some kids have just they're drinking soft drinks or caffeine, and that can cause some difficulty with eliminating. So if your child is into soft drinks or caffeine, that's an easy one to eliminate. Don't do that. The other big culprit for a lot of kids is they just get really highly focused on something, and then they lose all of that good interoception they've been working on in OT. So we try to get them back on a good schedule. Maybe we give them some little watch that alerts them that it's their time to go to the bathroom, or we remind them in other ways. There are other ways that we might think about reminding them about going to the bathroom, and we can actually do some special underwear that we can do either during the day or the night. The bell and pad technique is one of those. So the bell and pad technique is actually now done with underwear that is highly sensitive. It has just a little bit of a sensitive wire inside. It's totally not exposed, but it's attached to something you plug into your wall. And as soon as just a little bit of drop hits the underwear, the alarm goes off on the wall, and that alerts the child, oh, I guess I have to go. And then they'll go. You can use that both at night or during the day, but it's just another way of kind of retraining the brain, like, oh, I need to go. So most often parents and children are using these at night because most often we're having nighttime wetting. Nighttime only wetting is a concern a lot of parents have because quite frankly, nobody likes to do a lot of laundry. And they feel like, again, this is a barrier to independence. They feel frustrated that children haven't quite achieved nighttime dryness. You don't have to go too far, though, to see a commercial for Good Nights, the pull-up for nighttime, to know that there's a good percentage of kids who haven't achieved nighttime dryness. And this is really, neurological and based in nature. Most children who have some neurodiversity will have some difficulty in achieving nighttime dryness later than their same aged peers. There's some variance in that, of course, but it's due to some neurological immaturity. So you can do a lot of things. You can certainly restrict fluids. It's helpful for about 15% of kids. But some parents, swear by it. You might risk, dehydrating your child. So you might do better just to maintain adequate hydration over the course of the day. Certainly kids who are dehydrated will also still wake and need to use the restroom. You can also set an alarm clock and wake your child. That doesn't reduce nighttime wetting. It just wakes you and the child up. So nothing has changed in their neurology. Punishment is the number one thing that doesn't work, as everyone else has chimed in about. Some parents will say, well, I'll just have them do their own laundry. They'll learn. They certainly do learn how to do their own laundry. So that is true. I think a lot of people feel as though, they know better, but they don't. There are some children who might purposefully urinate in parts of their room rather than in their bed. And that's a very different type of child. Children who urinate while they're sleeping are children who are unaware. There is a subset of the population who might willfully, at some point in their life, urinate in parts of their room. That's a different kid. But children who are urinating during the night are not aware of it. Some families will elect to get a medication from either their pediatrician or their psychiatrist that will suppress the hormone that produces, it's called vasopressin, and it helps because it suppresses your ability to urinate during the night. You can certainly do that. Some parents will do that, especially for sleepaway camps and things like that. It doesn't change neurology, but it can create a period of time where the child will not urinate at night because it does suppress that hormone. But again, it doesn't change the overall neurology of that individual. So if you're seeking to provide a more typical experience for your child for like sleepaway camp, that's a great option. But they still have to take a medication. And once they stop taking that medication, you still have the same issues. The other, like I said before, you can do the alarm system with the underwear that as soon as it gets a drop of urine will awaken the child and you to get them to go to the bathroom. Just like with primitive reflex training, it takes several weeks really to get the child to fully use that system and start waking on their own to get up and go to the bathroom, even before the alarm would then go off. And what that says neurologically is that, hey, now we've changed how our brain works, just like it would with primitive reflexes. I don't know if they're exactly the same, but there's some interesting neuroplasticity that's happening in how our brains are changed because of that repeated, hey, I have to wake up because I have to go to the bathroom. And I think there's probably a similar function that's happening and how we might, change the, the neurology through primitive reflexes. It may be a totally different function, but there's still some neuroplasticity that's happening and changing. If you are interested in bedwetting alarms, the magic underwear that makes you wake up or sets off that alarm during the day or during the night, you certainly can go to what's called the Bedwetting Store online, and you can order the underwear and the alarm system. So it's just online. It's the Bedwetting Store. I recommend the Roger Wireless. I think that fits most kids. They have a wide range of sizes. When you do that, you want to get a few pairs because you're going to do some laundry. And hey, if you've already taught your kid how to do laundry, they can do it themselves. But you also want to get some pads to put underneath them because it's not perfect for several weeks. And you want to save yourself some extra laundry. But that's what I recommend. I find with most of my patients, those are pretty helpful. It doesn't mean that that's a forever thing. Oh, somebody's telling me I'm done with that slide. It doesn't mean that it's a forever thing. Sometimes kids relapse, and that's true with all of our toileting, right? There's a wax and wane. There's we get good at something, and then we get less good at it, and then we have to go back and retrain a little bit. I want to talk a bit about shaping. Sometimes we get good at one thing, but then we need a little help with another thing. And sometimes the best way we can do that is with a procedure called shaping. This is something Sam can tell you a lot about too. She does a lot of shaping with behavior, especially with older kids. They may be averse to wiping, and that might be an issue you have with some of the individuals you have in your house. It's something I run into a lot with my patients. So wiping is just hard sometimes. We don't like the texture of toilet paper. We don't like how it feels. We don't like what we're wiping. These are all terrible things. So getting somebody on board with wiping can be hard, especially if we have some poor coordination or motor control. So the strategy that I try to use with some of those individuals is to use Bounty or the store version of Bounty, and to cut that in half because that's what feels most like a soft toilet paper, and it tears like a soft toilet paper. You can also wet it at first. And so you're using kind of a wet Bounty type paper towel to wipe. Then you take you put that into a garbage can that's been filled with the garbage bag or the grocery bags from the grocery store, so that each time you do that, you can just throw away those garbage bags from the grocery store. And so over time, you move from a wet paper towel to a less wet paper towel, to a dry paper towel, to a Charmin, or something soft. Maybe you don't fully move to Charmin. Maybe you move to the Dude wipes. That's okay. Those are flushable, If you just can't get there, you can't get there. But you've gotten a place where you are more independent in wiping. And that's the goal. The goal is to get to independence. The goal is to get to a place where it's less adversive. And I find that this is a place to get there.
When we think about toileting, there's also a lot of anxiety that comes along with it, especially for older children and young adults. We want to make sure that we're taking a very gentle approach to toileting and making sure that the child and young adult is feeling supported and that they're able to express their fears, their concerns with toileting as well as much as they can. As kids get older, it might become more uncomfortable for them to have their parents involved in toileting as much as they were in the past. So this might help drive motivation for them to work on some of those skills to be more independent with toileting, but they're likely still going to need some supports from their therapy team to make sure that path to what independence looks like for them is a supportive one. And it's really important that we are trying to meet older children and younger children with compassion when they're working on toileting. It is a hard skill, like we talked about today. There's lots of components that go into it. And we want to make sure that if there are any underlying factors that are causing anxiety, whether that's social drivers, sensory drivers, whatever that is, we're trying to address that as much as possible as well. And also knowing that independence and toileting might look different for a lot of people. It might be that they wear adaptive clothing. They might have different environmental supports that they have when they go to the bathroom. Maybe they stick to a pretty strict schedule of when they use the bathroom. Those are all things that are okay. Like Suzanne said, we are working for independence at whatever independence looks like for individuals. And now we'll take any questions.
There is one question in the Q&A. If anybody has other questions, you can type them into the Q&A or you can unmute yourself. Here's the first question. Any specific insight or suggestions for a child that moves bowels only while asleep?
That's a good question. I think from an occupational therapy standpoint, there might be some reflexes involved that are with bowel movements, where maybe that reflex is just retained and it within that child's cycle is happening at night. So that might be a component. But there would need to be more things that were looked at as well to identify that.
There is another question about the PowerPoint. Will this PowerPoint be available if for sending out afterwards to the speakers?
Yeah, we can send it to you guys if you want to pass it along to.
Yeah,
But yeah.
perfect. That would be great. We've got 4 more minutes if there's any other questions. There's no more in the Q&A, but if you want to unmute or raise your hand, we can certainly call on people to ask. Here's one. How can I generalize what my son is learning in our home? Potty training has improved in our home, although he is still having bowel movements on the floor in other environments, not at school or in our home, but in other homes.
That's a good question. Based on the question, I think that if there's a way to sort of signal, there's a couple of ways, there's many paths to this, but one way might be if there's a way to practice in other environments proactively. So if you are going to another person's home and you maybe after 10 minutes of being there, go to the bathroom and we practice, it might help kind of help the child feel more comfortable, but also help us understand if there's something else that we're missing. Maybe it's a specific bathroom setup, or maybe it's something that we had originally not planned on kind of teaching in your home. So it might help us kind of understand their comfort level with that.
Any other questions? If there are no other questions, oh, here's another one just popped on. My daughter is 5 and nonverbal. She sits on the toilet and goes through all the motions, yet has not actually gone in the toilet. Any suggestions? She goes to preschool.
Yeah, I would say, I guess from my lens, I would start with that toileting checklist and see if there's any area that you are seeing that she is doing or what area she may not be doing yet. Start with that checklist. And then I would also take a day of that data that would help you kind of better understand how often she's going. What's really interesting sometimes we see is that kids do hold their bladder for a really long time. For example, in that instance, that where we wouldn't expect them to go every time that they sit. So it might be just good information to start with to see how often she is going when she does have a diaper on.
I think the other piece is to really give yourself some grace. You know, if we're really anxious about it, that can kind of befuddle the situation too. So to make sure you're having some fun with it is always important. Kids do really well when we're playful. So relax, give yourself a break, and see if when you're having fun with it, if she's able to have some fun with it too.
I think that's the last question. So I want to thank our speakers, Samantha, Suzanne, and Maggie for being here today. And we will email the recording as well as the PowerPoint out to all of the registrants today. That'll happen probably in a day or two. So you can expect that in your email. And we thank everybody for coming and hope you all have a great day. Thank you.
Thank you.